When you first encounter a person who you think is having a cardiac emergency, you need to check to see if they are unresponsive. To do this, shout, "Are you okay?" and tap their shoulders. Next, check to see if the person is breathing and the scene is safe. Your safety is still a priority. If the scene is safe and they are unresponsive and not breathing, call 911 and begin CPR right away. To start, move the person to a hard, flat surface if you can. Then place the heel of one of your hands on the person's breastbone. Put your other hand on top and interlock your fingers. Make sure to keep your fingers up and off the person's chest. To locate the correct hand position, place 2 fingers at the bottom tip of the breastbone, where the ribs come together. Then place the heel of your other hand at the top of your fingers. While keeping your arms straight, push down on the chest and give 30 compressions. You should give these at a rate of 100 to 120 compressions per minute. Make sure your shoulders are directly over your hands to give the most effective compression. This will help ensure you don't tire quickly, as you will be using the weight of your upper body to push down instead of your arm muscles. Make sure your compressions are in a smooth and steady rhythm. Do not pause between compressions. After you've given 30 compressions, it's time to give 2 breaths. To open the airway, place one hand on the person's forehead and 2 fingers from the other hand on the chin bone. Then tilt the head back and lift the chin. It's best to use a breathing barrier or resuscitation mask when giving the breaths. Don't waste time looking for one though. If it is safe to do so, proceed without one. Take a normal breath and then blow into the victim's mouth. Each breath should last about a second. The process of giving breaths during CPR should last less than 10 seconds. When you give the breaths, pinch the nose and watch for the chest to rise. If the chest doesn't rise, retilt the head and try again. Never give more than 2 rescue breaths between compressions. If the rescue breaths still haven't gone in, give 30 more compressions, but check the person's mouth for an object before giving more rescue breaths. If there is an object, remove it. Keep performing CPR until the person regains consciousness, the situation becomes unsafe, EMS arrives, or you are too tired to continue.